Hi, my name is Chantel Beam. I'm going to be your nurse today. I'm going to wash my hands for 15 seconds. And I also have hand sanitizer that I'm going to use before I do this physical assessment on you. What is your name, please, sir?
Silas Silva.
And your date of birth?
August 20, 1991.
Well, are you experiencing any pain anywhere in your body today?
No.
What is your pain level on a scale from 0 to 10?
0.
Okay. And what is the year?
2020.
What is the season?
Fall.
Where are you located?
Living room.
Yes. And what is the president? Who is the president?
Donald Trump.
Okay, thank you. That was a test to assess your level of consciousness. Here and your scalp. And it looks good, good condition. Are you experiencing any numbness or tingling inside of your body today?
No.
Can you please frown? Make a sad face like this. Can you raise your eyebrows? Great. Can you smile? Thank you. Can you puff out your cheeks? Great. Everything is normal. Mr. Silva, do you have any vision problems?
No.
I'm just gonna assess both of your eyes to see the conjunctiva, the pupils, the sclera, and just to see like if there's any abnormalities in your eyes. I'm gonna shine this light into your eyes, and your pupils are gonna constrict when I do that. So if you notice anything different, it's just the light shining in your eyes. Mr. Silva, I'm going to assess your ears and assess the alignment to see if they're symmetrical. So I'm going to take a look at both sides just to see if they're even. And then I'm going to assess the pinnae. I'm going to palpate it. I'm going to put my pen light down. Now I'm going to get my pen light and pull your ear up and back to look at the tympanic membrane. Okay, everything looks great. I'm going to go over to the other ear and take a look inside and look at the tympanic membrane. Looks good. Now I'm going to assess the position of your nose to see the alignment. And it looks clear, it's normal and even. The patency, I don't see any openings. It looks good. I'm going to take my pen light just to look at it a little bit better. And inside of the nose looks clear. There's no cuts. Everything looks good. And the next thing I'm going to take a look at is inside of the mouth. So I'm going to assess your mouth just to see if everything is normal. I want to take a look at your lips first to see if there's any cracks, any cuts, and that looks good. Can you please open your mouth so I can take a look at your gums and your buccal mucosa? And just want to take a look at the teeth inside of it. And can you please stick out your tongue? Looks good. Lift up your tongue. Under it. Great. Thank you. Inside of your mouth is moist and pink from the examination, and that means it's good. Just going to assess your trachea to see if it's symmetrical, if it's midline. And what I'm looking for to see if there's no deviations, it's not going off to like the right or the left. And from what I feel, palpate, it is midline. And I'm going to assess the lymph nodes. And everything feels normal. I'm gonna test your skin trigger on your clavicle. So what I'm gonna do, I'm just gonna take a little piece of your skin here at the clavicle mark. And that clavicle mark is right here. I'm just gonna pull in to see like what happens. And you have good skin trigger. I'm going to test the strength in both of your hands at the same time. So what I want to ask you to do, sir, is put your hands on top of mine and push down. Oh, wow, very strong. And I have my hands on top of yours. You're going to push up. Oh, okay, wow, very strong. I want to test the strength in your hands and the symmetry in both of your hands. So can you please squeeze my fingers? Okay, wow, thank you. Gonna assess the range. I'm going to assess the range of motion on your arms. Can I please see your arm? So I'm gonna go like this. And can you please spread your fingers, close them, spread it, oh, bring it back to the camera, sorry. Spread it, close it, spread it, close it, and lift your wrist. Yep, yep, great. Spread it to the other side, and okay, go ahead, lift it up yourself.
Okay.
And go out. Yeah. And then open your fingers, close them, open, close, open, close, and then lift your wrist like this. Yes, thank you. I'm gonna take a look at your, I'm gonna assess your breathing patterns and your respiratory system and see how your lungs are working and see if, I'm gonna see if you have any wheezing, any crackles, or if everything is normal. So at each place where I put the stethoscope, can you please just breathe in when I tell you to breathe in? Breathe in. You can breathe out. Breathe in. 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 And one more time, please breathe in. Everything sounds clear and regular, and your respirations sound great. I want to do the posterior of your body, and I want to check your lung sounds from your back. I'm gonna assess the lungs from the posterior of his body. That means the back side. So I'm gonna start with placing the stethoscope, and I'm gonna ask you to just breathe in. Can you please breathe in? Thank you. Breathe in. 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 And breathe in. Your lung sounds clear. I don't hear any crackles, any wheezing, so that's a good thing. It's my patient's neck to see if he has jugular vein distension. The jugular vein is located along the sternocleidomastoid, and my patient is at a 45-degree angle. And most of the time when the patient's at the, well, all the time when the patient's at the 45-degree angle, you'll be able to visualize the sternocleidomastoid, which is over here. And sometimes you cannot see the jugular vein, but you can palpate it. And I don't feel that it's distended with the index and the middle. And I'm gonna go over to the other side. My patient's at a 45-degree angle. I'm gonna visualize the sternocleidomastoid and the jugular vein. And I do not see any distension. I do not feel any distension as well. Have you ever experienced any dizziness?
Nope.
I'm gonna assess your heart sounds to see if they're normal. I'm gonna start with your aortic. Then the pulmonic. And the Erb's point, and the tricuspid, and the mitral. And it sounds normal. I'm going to assess the patient's apical pulse, which is located at the left fifth intercostal space medial to the midclavicular line, and that's over here. I am going to count for 60 seconds as I listen to the lub dub. And from what I hear, it sounds normal. And now I'm going to assess the patient's radial pulses bilaterally. And I'm going to take his hands. He has good, strong pulses. A good, strong pulse. And I'm gonna check. And it's normal. Now I'm gonna check the capillary refill. It's less than 3 seconds. And it's normal. And I'm just gonna check for any clubbing in your fingers. And then they look normal. I'm gonna ask my patient about his last bowel movement. When was your last bowel movement? When did you last use the bathroom and go number 2?
Like in the morning.
Okay, and what was the color?
Brown.
Have you been having any diarrhea or constipation?
Nope.
What about any nausea or vomiting?
Nothing. Nope.
Now I'm going to inspect my patient's abdominal area to see if it's okay and if it's normal. I'm going to inspect to see if there's any distension to see if it's round or flat, which is normal. And what I'm seeing, which is I don't want to touch it and inspect first, I'm seeing that it's flat and that's normal. And so now I want to listen to the bowel sounds. I'm going to auscultate, which is listen to the bowel sounds. And first I'm going to start with the right upper quadrant. And the right lower quadrant. The left upper quadrant. And the left lower quadrant. And it's active. I'm going to auscultate my patient to listen to his bowel sounds. I'm going to use the bell to do that. I'm going to listen to the sounds starting in the left upper quadrant. I'm hearing some clicks and gurgles. In the right upper quadrant, the left lower quadrant, the right lower quadrant, I'm hearing about 20 sounds, 15 to 20 sounds each per minute that I listen to each of the quadrants. And now I'm gonna palpate the abdomen to see if it's tender and it's non-tender. When did you last void? Like, when did you last urinate? When did you last go and pee?
5 hours ago.
Okay. And do you, are you continent or incontinent? Meaning, like, continent meaning that you can go to the bathroom on your own. Incontinent means that you tend to pee on yourself. You're continent?
Yeah.
Okay. What color is your urine? Is it like a
This is regular.
yellow color?
Not too yellow. Like maybe regular, like normal.
Clear.
Like clear. Yeah.
Okay, great. And do you have any difficulties when you're voiding, like when you're peeing? Does it burn?
Nope.
Is there any difficult with the stream that comes out?
Nope.
Okay. So we're almost done. So we're finally on the last part of the assessment, Mr. Silva. I'm going to assess the capillary refill inside of your toes to see if it's less than 3 seconds. So I'm going to press on each of them. And it's good. And I'm going to assess your bilateral pedal pulses. Pulse is present. Pulse is present. And they're both strong, so bilateral. They're strong. Your pulses are good. Now I'm just gonna ask you to push against my hand so I can see your strength in your foot. Oh, okay, very strong. I'm gonna also assess for edema. And there's no edema. And I want to test the muscle strength of your legs. So can you raise one of your legs? Since you're in a laying position, can you just raise your left leg for me? Great. And you can put that down. Can you please raise your right leg? Okay, so there's bilateral strength, even. Great. So now, sir, we're going to assess your gait. The gait is how you walk. Now I'm going to assess Mr. Silva's gait to see how he walks, to see his balance, the rate on how he walks, to see his movements. You can go ahead and walk forward. And come back. And he has a good gait. I assess the patient's body for any ulcers, any rashes, any wounds, swelling, scars, and any distension. And he's checked out to be great.